And we're live. Good evening, everyone, and thank you for joining Sisters Healing and Evolving's She Healthy Woman monthly podcast. We are excited tonight to bring to you this conversation, this candid conversation around heart health and the African American community in light of African American Black History Month and Heart Health Month. We have a video in honor of the first Black nurse that we would like to share with you first tonight before we jump in and introduce our guest speakers. We have two lovely nurses with us tonight from Black Nurses Rock, Greater Charlotte, and I am excited to have this conversation with them. I'm excited that they have joined us. But we're going to give honor where honor is due, and we're going to play a short clip for you tonight. Just honoring Mary Eliza Mahoney, the first Black licensed nurse. Thank you for watching. And now, without any delay, I am excited to bring to you Miss Deborah Crawford. She is a registered nurse. She is a mom. She's a wife. And she is the president of Black Nurses Rock, Greater Charlotte. Ms. Crawford, we thank you so much for being with us tonight. I'm excited that you have joined us for this conversation. I am just eager to hear what you have to say and share with us over your 30 plus years of experience as a nurse. And I want you to introduce the lovely Miss Simone Bailey, who has joined you tonight, also from Black Nurses Rock, Greater Charlotte.
Hi, thank you so much for having us. I would like to introduce Simone Bailey. She is the great treasurer of Black Nurses Rock, Greater Charlotte. She keeps me in line, but she does more than that. She also won an award last year for being from Carolina Nursing Association as a top RN. And she currently works as an RN in two capacities, one in the insurance side and then one on the hospital side. So she's kind of like done it all and is in the middle of it all. So she's just an awesome nurse and a great person to have as your sidekick. So that's Simone Bailey.
Thank you.
Thank you, Simone, for being with us. I'm excited that you've joined us as well tonight to join this conversation. Do you want to tell us more about yourself, or you want to say anything before we get into the conversation tonight?
Sure. Yes. I'm also a mom. I'm a nurse. I used to be at Winston-Salem State. I used to teach students when they first come in. I like to teach. I like to educate. It's great to see, one of our own going into the profession, so that when a patient sees, oh, this is a Black nurse, they're more comfortable. We're more comfortable with our own kind. So I love to teach and educate our new nurses coming in. I was originally in the military for 5 years, and then I left and came out. I went back to nursing school and got my bachelor's. I've been a nurse for approximately 14 years now. I've worked in urgent care. I've worked in primary care, the hospital on med-surg, where we see it, but everything from kidney disease to pneumonia to high blood pressure. And then also I work on the opposite end as insurance company. So I review charts. So I see what the doctors are doing, what they're requesting, making sure that what they're ordering is up to date, or, I send it to my doctor and say, hey, it's questionable about what this doctor's ordering. Can you look at this? And that is me in a nutshell.
Wow. You have you're wearing many hats. Seems
Yes.
like you're touching every aspect of health, and that is an awesome thing. And I'm eager to hear what you have to say tonight, being that your experience is so vast and so diverse.
Okay.
Amen. Wow.
She
So we
is
have some
diverse.
wonderful women with us tonight. And so I'm excited because heart health, as we know, it touches the Black community at higher risk than it does for our non-white, non-Hispanic whites, and we are at a higher risk. We face more more predisposed, and we have different social aspects that create barriers for us. However, it is up to us, as we were speaking earlier, Ms. Crawford and I was saying that we have to be able to navigate these things, so that we are being more proactive and preventative with our health versus being reactive. So,
Yes.
Ms. Crawford, please share with us what is heart disease and how is it affecting the African American community?
It's one of the it's the top killer for Black people or African Americans, however you want to put it, but it's the top killer for us. And it's for various reasons. Some things we can change and some things we can't change. So the things that we can change are being more active, watching our diet.
Mhm.
What can we do? But heart disease encompasses a lot of diagnoses. It encompasses high blood pressure. It encompasses coronary artery disease, where you have buildup in your artery, so the blood is not flowing as properly as it should. It encompasses heart failure. It encompasses the trigger that can be the domino effect, I like to call it, because if your blood
Mhm.
pressure is high, then it's going to cause problems with your kidneys. And then you're going to have problems with diabetes. So it's like a triangle effect. They kind of domino off of each other. So heart disease is used as an all encompassing diagnosis, but it has a lot of subsets to it.
Okay.
And to add to that, let me I'm do the technical part of it about what exactly is high blood pressure and in African Americans. So in the US, African Americans have the higher prevalence of high blood pressure than other racial or ethnic groups. It's often more severe in African Americans, and there are some medicines that do not work or are effective for
Mhm.
treating Black people. Um, it does usually have no symptoms, and that's why it's called a silent killer. The only way you know is you have high blood pressures to have your healthcare professional check it. So you go and you get your physicals yearly. Even from the person that's 18 to the person that is 75, you have to get that physical. Um, when you have symptoms of high blood pressure, that's when it's severe. That's when you're going to
Mhm.
need medicine. That's when you're at stroke risk. So if you get your annual screenings, it's something they can pick up early. And maybe you can fix it with the diet or the exercise before you need medicine. But at some points, you might need medicine, maybe one or two. And that's where people get frustrated when they say, well, it's not working. And the doctor keep adding medicine, but the medicine works in different ways. One can drain fluid from get fluid off of you. One can open up your arteries. There's so many different medicines to use. Um, but if the point is, if you get that physical and they recognize, hey, your blood pressure is slightly high, it's something we can keep an eye on. They can catch it sooner. Go ahead. Sorry.
Yeah. And most people think of um, hypertension or high blood pressure, as it's called. And so, what that is it's made up of two components. The most important thing is to know your numbers. It's made up of two components: the top number and that bottom number. That top number is the pressure of the blood when the heart is beating as it
Mhm.
goes through your arteries.
Okay.
That bottom number is the pressure that's going through your arteries when your heart is at rest between the beats. And so it's important to know both the top and the bottom number. That's why it's so important to go to your doctor to know where things stand so that you'll know. Because, like Simone said, a lot of times you don't know that you have high blood pressure until it's severely high. You don't get those symptoms until your blood pressure is severely high. You may all of a sudden start having these nagging headaches, and you're wondering, why is my head hurting all the time now? Most likely it's because your blood pressure is too high, or you've had too much salt, which has then raised your blood pressure too high, because it does impact your blood pressure. But there are so many other things that can impact your blood pressure. But it's important to start with knowing your numbers. Go and get your blood pressure checked and
No.
ask questions.
And what would be a good blood pressure, being that we are all different shapes, different sizes, different body mass? What would be a good blood pressure? Or when would we need to start worrying?
Okay, so American Heart Association recommends a normal, and I'm going to quote it, normal as 120 over 80. That is what baseline is when they say normal, but we know everyone's different. So when you check it with your doctor, some people may run 100 over 60, some people may run 130s over 80s. When you have that doctor that you're seeing and he's checking your blood work, he's checking your vitals, he's checking everything else on you, and you're running 130s over 80s or 80s, we're going to say, and nothing's wrong, then he's going to keep an eye on it. Yes, we'll check it every year. Now, if you normally run 120s over 80s and then now you're 140s over 90s, that's something to keep an eye on. But we need to remember that one high blood pressure does not mean you have hypertension. So people have white coat syndrome. As soon as they see the doctor or the nurse come, they start stressing and that blood pressure goes high. So normally your doctor would check it, have you rest a little bit and check it again. They might say, oh, it's still high, come back in a couple days, or tell you to check it at home.
Mm-hmm.
When you have that physical with your doctor, that's when they're going to know what's normal for you, for your body, or what they consider normal. But the national guideline is 120s over 80s. You start worrying when it gets like the 130s over 90s. Anything else, Deborah, you want to add?
No, that was said perfectly. It depends on the person. Everybody functions differently. Some people can tolerate a lower blood pressure, but that's for your doctor and you to decide. If your blood pressure is lower than that textbook perfect number and you're functioning properly, then that's your norm. Some people need their blood pressure to be a little bit higher to function and not feel like they're dragging around. But again, that's for you and your doctor to come up with what's the best range for you to be in. And the only way to know that is to get in and to see your doctor.
And I've heard you stress several times, seeing your doctor. It's important. We have a lot of stigma in the African American or the Black community, if we just want to be candid about it, when it comes to trusting doctors. We have a lot of mistrust in the medical profession. Some of it is due to maybe lower standards of quality. Some of it is due to we just have been conditioned not to ask questions. I know for me, it is a pet peeve of mine when people go to the doctor, and I'm just going to say, I have family members that go to the doctor, they don't ask questions. And we're not advocating for our health. We're just allowing them to give us tests. They give us tests. They don't really give us the results or go into detail enough for us to get a better understanding of the results. How do we encourage people to ask more questions when it comes to their healthcare, so that we can begin to reestablish trust and overcome this barrier of mistrust in the African community?
The first thing I would say is that you have to find a doctor that you're comfortable with.
Right.
Going to a doctor that you're uncomfortable with, you're not going to ask questions. You're just going to take everything as face value if you listen to them at all. So the first step would be to find that doctor that you feel comfortable with. It's okay to leave a doctor. Know that it's okay to leave a doctor if you are not comfortable with that doctor. Where there's one doctor, there are plenty other doctors. You have to find one that you're comfortable with, one that you're okay with asking questions. Doctors, believe it or not, they want you to ask them questions because you know your body better than anyone else does. All they can do is give you advice on based on what tests that they see, what those results are, and how you present into that office. So you have to find a doctor that you're comfortable with, and you have to do some homework. You need to start writing before you get to the doctor's office. Have your list of medications and ask them, why am I on this medication? What does this do for me? When they want to give you a medication, how is this going to help me? What are the things that I need to look for? A doctor should be explaining those things to you. If you go and you have tests done, why am I having this test? What are we looking for? What are you hoping to find? And what are we going to do about it if you do find those things? But the first step is you have to find a doctor that you're comfortable with. I have left many doctors' offices because I felt like I've been on the other end of the spectrum where I felt like I wasn't being heard. And the first thing that I do is I don't tell them I'm a nurse, because I want to know how you're going to treat me without knowing that I'm a nurse. How are you going to talk to me? Are you going to talk to me in terms that I can understand? Are you going to be throwing out all these $100 words that you got from medical school? Talk to me so that I can understand you. And if you can't do that, then it's time for me to find another doctor, because everyone needs to be heard. You need to be respected. We just had someone who did their dissertation for their PhD on the stigma in healthcare and why particularly Black men didn't go to the doctor. And it's because of trust. Because we had, like the Tuskegee experiments, and that started some of the distrust. But we have to now take some of our power back.
Yes.
And find that doctor that will answer your questions. If a doctor makes you feel like they can't answer your question, or they don't want to answer your question, that's not the doctor for you. And it's as simple as that.
To add on to that, when you say changing doctors, it's not a problem to get a second opinion. Just because Dr. A said this is what you need to do, you can always go and see another doctor in that specialty, etc., and see if they agree with it, or is there something else. Being prepared, research your information. I mean, it's okay to look online, but WebMD is going to give you cancer regardless of what you did. I'm joking about that, because sometimes you put in stuff and you think you have this, but it's okay to research, but go in and say, hey, this is what I found. Can you explain to me, etc. Write your questions down before you go in. The doctors have primary care, have 15 minutes per patient. That is not a lot of time. So it seems like they're rushing you. But if you have your questions down and said, hey, I looked online, this is what it said, can you explain to me? As long as they can answer it without making you feel like, why did you look that up? Then, you build that trust with them. Say, you don't want to go in there saying, well, this said this, and this is what you need to do. Can we discuss this? We're a team. We need to work together. So that's the most important thing. Just have your questions ready. And if you don't feel comfortable, go get a second opinion. Another doctor might say, yeah, what they said is right, or we can try something different. There's other steps to do it.
And that 15-minute time crunch is a lot that they have to see patients, and you really can't get to know them in 15 minutes. That's why follow-up appointments are so important. Is because that first visit can only be about 15 minutes. Unless it's a new patient, they may give you 30 minutes. But you still want to be armed and prepared. You want to go in there knowing this is how I've been feeling. This is what I've been noticing. And this is what medicines I take. And tell them a list of all of your medicines, not just the ones that you take every now and then. They need to know everything that you take, including over-the-counter medicines, so that they can have a whole picture of who you are. But you have to start with somebody that you're comfortable with.
Yes, and I agree. And it's just going back from seeing my grandparents, and mainly with older African-American people, they are loyal to their physicians. They are loyal to their doctors. And it doesn't matter what you say, they will not change that doctor for anything. And I can remember a time when my grandmother, literally, she had one of those little cooler bags
Mhm.
filled with medications.
Mhm.
And I just couldn't for the life of me figure out how can any of this be working for her. And the more we tried to get her to go to a different doctor, it was like pulling teeth. And she was like, no, I like my doctor. I like my doctor. I trust him. And I'm like, well, we're not, you're not asking questions. Every time you go, you come back with a different medication. And so it is challenging as, a family member to see their loved ones still with doctors and maybe needing that second or third opinion, and not doing that. So, we to help them, we can ask questions, we can visit with them. I started visiting the doctor with my loved ones because someone needs to ask the questions.
Mhm.
What is these medicine? Every medicine has a side effect. How are these side effects canceling out the other medication? How is this working? So yeah, it's important that we do trust our doctors because they are the ones helping us to manage our health. I noticed also in my research today that stroke has touched my family. My father passed away from a stroke at the age of 51, complications of a stroke. And I noticed that it says that we are, touched by it. It's one of the third leading cause of disability.
Mhm.
And we're touched by it the greatest. And I know that it has to do with the blood pressure. Can you bridge those two so we can get a better understanding? How do we prevent stroke? And I noticed also that Black women are at higher risk of developing high blood pressure and at a younger age.
I want to back up just for a minute. You're talking about the older people
Mm-hmm.
and going to the doctors. They have always been raised that these are people of high standing. So they tend not to ask questions to them because they don't want to come off as being disrespectful. But I always believe that people, when they're older, should never go to a doctor's appointment by themselves because one, they may not remember everything. Two, they're not going to ask the questions. And three, they take everything at face value because it just came from a doctor. And we
Mm-hmm.
need to always make sure that we're going through their medications and making sure that they are taking what they're supposed to be taking and not hoarding old medicines
Mm.
because that can be harmful to them as well. So I just
Yes.
wanted to put that out there. But to bridge the gap between stroke and high blood pressure, stroke is one of the causes is high blood pressure because that pressure in the arteries has gotten to a point where it's so high and it can cause a brain bleed, which is a stroke, which is a type of stroke that you can have because the blood pressure is so high. And with women, one of the major causes of that has been because more women are now in the job field, and they deal with more types of stress lately than we had been in the past. You have more working mothers, more women in the job field, so you have that added stress on top of that. Then you put the stress along with a bad diet, a sedentary lifestyle where we're not moving and that's physically active. We're working and so we're eating out more. So that's more sodium in our diets and more fat in our diet because we're not preparing our foods at home anymore because we're working. And sometimes it's just easier to grab something out than it is to cook at home. And
Mhm.
so then you have that aspect of things too. So it's just like a combination of things stacked on top of each other that tends to lead us to be affected more by strokes or to
Smoking
have.
is also a risk factor. Sorry,
Mhm.
I thought you were done. Sorry. Smoking is also a risk factor for stroke.
Yeah.
Um, but controlling your blood pressure, your diet, physical activity, etc., that's important to prevent a stroke. But we also need to recognize what a stroke is. So as women, we do tend to put stuff off. So if my chest is hurting and my arm is hurting, oh, I'm just stressed, I'm going to keep on working. Well, that's a sign of could be a heart attack. So for women, we don't recognize the signs and symptoms, or we see the symptoms, but we just put it off because there's other things to do. That's why women are at higher risk for heart attack, heart disease, etc. So the signs and symptoms of a stroke: sudden numbness or weakness in the face. When the person smiles, one side of the face is drooping, the eyes is drooping, they can't keep it open, trouble walking, trouble seeing, confusion, and severe headache. So the most important thing for a stroke is, if you have those symptoms, you need to get to emergency care immediately. That way you can reduce the risk of any of the symptoms lasting. So of having to go to PT, etc. If they catch that stroke early, they can give medicine to prevent any deficits from staying. So you got to recognize what the signs are, and then you have to go to the provider. You can't say, "I'm going to go tomorrow. I'll go follow up next week," because by then you have
It's too
damaged.
late.
You've done too much
Mhm.
damage to your body, to the cells, to your brain. That you're gonna have to be having physical therapy or be in a nursing home until you can get your strength back, if you can.
Yeah, unfortunately, a lot of times we do put those things off and we ignore the symptoms because as women, we don't want to be seen as a complainer. Don't want to be seen as a complainer. But then when you do have those symptoms and they persist, the time is the number one factor with the stroke, because there's certain medications they can give, but it has to be done within a certain amount of time. And so if you notice that, like she said, this facial drooping, they can't stick their tongue out straight, slurred speech, and it's not due to alcohol or overindulgence. They can't hold their arm up. The balance is suddenly off. Those are all signs of stroke. So you need to call 911. You don't need to drive yourself to the hospital. You need to call 911 because things can change so quickly that you can't be managing that as you're driving. Someone
Um,
doesn't need to drive you to the hospital. They need to call 911 because things change so quickly in a car that if you're with medic, they can do things about it. Whereas you're driving someone and they're declining right in front of your eyes, then you tend to panic. Now we have two people to take care of instead of one.
And I'm glad you said, don't drive yourself. We don't need to be driving ourselves, because that's the first thing that come to our minds. I'm gonna just get in this car and go on over to the ER,
I don't want to
or
pay the ambulance bill.
I don't want that. I don't want that EMS bill, because that bill
Mhm.
is high. Or I'm gonna just call my daughter and let her come and drive me over. I'm gonna get my husband to drive me over,
Mhm.
and that's the first thing that comes to our mind. We don't necessarily go first to call the medic. And I'm glad that you shared that, because we these are things that can make a difference. It could be life
Yeah.
or death.
Life or death. I'd rather have that medic bill and be alive
Mm-hmm.
than to have all these deficits now living in a nursing home because I didn't want to pay for an ambulance.
Yes, yes.
So
And
high blood pressure, high cholesterol, smoking, obesity, and diabetes, those are the leading cause of stroke in the United States. And it says like 1 in 3 adults have at least one of these conditions. So that puts you at risk. And, African American, we love that seasoning salt. uh, we eat out a lot, fried foods, but this is stuff that we have grown up from our parents and grandparents has passed it down. So now we have to learn, oh yeah, it tastes fine, but what is it doing to my body now? So we have to
Mhm.
change our habits. We used to eat all they give you the bread to fill you up, and all of that is not healthy for you anymore. So our mindset have to change. Healthier eating, but now the cost of living is so high. How can we eat healthy but still be able to afford it?
and that's key too. Just having those options of healthier food, fresh foods,
Mhm.
vegetables, having access to farmers markets.
Yes.
It does make a difference. I know, like I grew up. My grandparents had a farm, so we got a lot of our vegetables out of the garden. which we help to plant and to pick. So it's a difference. We know we can tell the difference in the food now. And just having those fresher foods, getting your eggs out of the chicken coop versus going to the store and purchasing them. Those are different, a different time. And now if it's labeled healthy or organic, quote unquote, it's at a higher price tag. How do people manage that with the rising cost of medication? And they're balancing and they're juggling that. What tips or strategies do you have that you can offer for those who may be facing that type of challenge?
It is a challenge. That's a big challenge because we encounter in doing some of our community service work, we have encountered people who are trying to make the decision of, am I going to eat or am I going to get my medication? Am I going to get gas or am I going to get my medication? And so how do we balance that? One of the things that is good that has changed is now that they've expanded Medicaid. So that if there's someone, the Medicaid levels, the money that you can make is a little bit more now. So if you think that you can be eligible for Medicaid, please apply because that can help pay for the cost of your medications. Explore some of the free clinics, the free pharmacies that they have, or sliding scale doctor's offices that are around, so that can free up a little bit so that you can try to make healthier choices when you're going to the grocery store. That can free up a little bit of money for you, whereas you were going to the doctor and having to pay a little bit more if you're eligible for Medicaid. Or like I said, sliding scale of visits. And it's okay to ask your doctor's office, is there a sliding scale if you can't afford to pay that full price? And so that can kind of open you up to pay, to have a little bit more money as a cushion to try to get things to eat. And we do have some farmers markets that are out there now. They're cropping up all over the place where you can get some fresher food items. If you can't afford to get the fresh vegetables, frozen is your next best option. We try to save canned for the least because they have to put sodium in it to keep it preserved. But fresh is best. But I know that it is most expensive, and just trying to get over that. And we need to make good use of what we have. When we do have food, we tend to cook all this food, and then we end up throwing things out because we've overcooked. And I know and I've been guilty of that because I've always been cooking for a lot of people. So we need to be better stewards of what we do have as well.
Pantries are a good thing. If you can look in your neighborhood to see if there's any free food pantries, that will help. Speaking about the canned, well, not even just the canned, but any processed food that we buy in the store, we need to be able to read the labels and read them correctly for sodium or salt intake. So if you look on the back of the can, it says sodium, which is salt, and it'll say how many milligrams it is. But you also need to look at the top where it says the total servings. So, for example, I show people like the taco season packet. It's like 237 milligrams of salt. But when you look at the top, it's per serving. There's 5 or 6 servings. So you're getting your whole amount of salt that they recommend a day in that one packet. So, and you look on your cans, you look on the vegetables, they also have salt. So they have some that says no salt or low salt. Those are the ones you would go for if you cannot get fresh.
Reduce the sodium.
And we don't by any means want to make it sound like this is something that's a quick fix. We've been used to preparing foods one way most of our lives, but that's one of the things that we can change that can help reduce the risk of heart disease and strokes. So we want to be able to change the things that we can, like she mentioned, smoking. Stop, you want to try to stop smoking. We want to try to eat out less, because the foods that we take that are prepared for us, we can't control the salt content in it. And then out of habit, a lot of us take the food that we're eating out, and we're shaking more salt on the top of it. So most of those meals that you're getting out contains your whole daily allowance of sodium that's recommended, and then you add more salt to it. And then we wonder why our legs are swollen, our feet are swollen, our hands are swollen at the end of the day, is because we've packed in all this sodium. And sodium is in things that you don't think of: breads, um, the taco seasoning, gravy packets, the oodles of noodles is just chocked full of sodium. All Most things that are quick has too much sodium in it.
And I also want you to touch base on smoking, because I know you said that smoking increases your risk of high blood pressure, of stroke, heart attack. There's a lot of people who are using, well, they're not smoking traditional cigarettes. They're using e-cigs,
Yes.
vapes, all of these different versions of tobacco. How does that play into the risk factors? Is that at a greater risk or is that a reduced risk? Share that, because we definitely have a lot of young people also who are using these new cigarettes.
Yes, and
So,
they are it causes an increased risk, especially for lung disease, because you're inhaling these things right into your system, right into your respiratory system, and it causes different things to happen with your lungs, and it causes buildup in your lungs, and that then in turn causes other issues. It doesn't really decrease your chance of having cancer. It increases your chance of other lung diseases, and it causes a greater risk because it's going directly into your system.
so let me get in the medical part of this. What it says is smoking increases the blood pressure and reduces the oxygen in the blood. So high blood pressure is a major risk factor. The smoking makes the blood stickier, which can also lead to blood clots. And so the chemicals in tobacco or those products is absorbed in your blood. So regardless of if it's a cigarette or the e-cig, there's chemicals in there that put you that makes your the vessels and the blood not work the way it should, increase risk of stroke.
And it makes the blood thicker, so therefore it can't go through the arteries as well. So then it's caused that more pressure on the arteries, which is why the blood pressure is higher. The e-cigarettes are more dangerous because they're flavored, and you can put other things inside of those other than just the little fake cigarette smoke flavor that they have. So they're more dangerous because they are flavored, they are geared towards kids, because it's supposed to look cool, it's supposed to taste good, but they're more dangerous because of it going directly into your lungs. They smoke more because they don't think of it as smoking, because they think of it as something that's harmless, but is actually more dangerous.
And that is true. That definitely is true. Um, but we have to be abreast of all of these things that
Yeah.
are causing us to be at higher risk. Um, in order for us to change the narrative, we have to change our mindsets. I think mindset is the biggest thing. I know that with education, outreach, and advocacy, we just have to keep it in front of people.
Yes.
Tell us more about um, Black Nurses Rock Greater Charlotte and your mission to reach the people and educate the people so that we can change the narrative of Black health.
One of our platforms is that we bridge the gap in health disparities. So what we do out in the community is that when we're invited to health fairs, to churches, to events like this, we share what we know. We do a lot on hypertension. We do some cancer screening information, and we share the information so that we can educate people so they can be empowered. to go into their doctor's offices and ask questions, or to go and say, hey, I haven't had my mammogram this year. Let's talk about that. I haven't had, for guys, I haven't had a prostate exam. Why are you not going? So let's try to allay some of the fears of going to the doctor to have these things done. You may find out something that you don't want to hear, but on the other hand, you could get some news that can just allay all the fears that you've ever had. So we go around the community to different health fairs, to different churches, to anywhere we're invited to help share information regarding healthcare. Not just hypertension, but we talk about diabetes. And again, we talk about cancer as well. And we want to do whatever we can to help bridge the gap in health disparities, because we want to show people how to get access to health care. Talk about the importance of seeing your doctor, to talk about the importance of taking your medication as ordered and getting your medicines from the same pharmacy, and stop going from CVS to Walgreens to your local pharmacy. Try to get your medicines from the same place, so that when you're getting a new medication, they can tell if it's something that will interfere with the other medications. So it's important to get your medications from the same place. And this is just some of the information that we share with people when we're out in the community. Basically, where we get an invitation, we try to go and try to just to share that information.
We also have the ability to refer patient. I keep saying patients, but people, if they don't have the access to the care, we can give a referral out and get them seen by a provider. Or someone will ask me, they're like, oh, I haven't been to the OBGYN. Who's a good one? Well, I don't know. I don't know them all, but I could recommend one. But now we have access. What's that program? I'm sorry, Deborah, that we can unite us, where we can put a referral in to and all I do is put the referral patient's name, phone number, and they'll call them and try to get them set up with whatever they need.
Or tell them about some of the local health clinics that are out there.
Free clinics, yeah.
That where they can go and see people. The food pantry, Loaves and Fishes is now Nourish Up.
Yep.
So food pantries, Second Harvest, different things like that. So Black Nurses Rock is a community of volunteer nurses who have come together with that common mission. We want to not only foster great care out in our community, but we want to also uplift each other and be supportive for each other. So we spend time also getting education ourselves and supporting each other in that way. And then that way we can support the community.
And it sounds like you are doing a lot out in the community educating. We need to educate one another. We need to be informed so that we can make informed decisions about our health care. I can't stress it enough. We have to be proactive. We have to advocate for ourselves. As we can see the health disparities and the risk that we are predisposed to, it's not improving. It's not improving. And if we don't take necessary actions and measures to change the narrative, to change our health care, to change our health situation, our health status, to know our health status, no one's going to show up and do it for us. And so I just employ people to know, see that doctor, ask those questions. And it's difficult sometimes, as you said, when we're out in the community and people are dealing with different health challenges, but they've not taken time to ask questions, to get more information or knowledge about these things. And it's like a complacent mindset almost that we are dealing with and trying to overcome. We have to stand up for ourselves.
Yes.
And we have to be our own advocate. No one knows your body better than you.
Yeah.
I always tell people, you know you. I know me, but you know you. And if something's not right, if it doesn't feel right, that's a sure sign for us to say something, to do
Yes.
something, and to get more knowledge.
And
Um,
we have to take pride
mhm,
out of the way. Yes, we are a proud people, but pride also gets us in trouble sometimes. A
mhm.
lot of men will say, I don't want to go to get a prostate exam because he's not touching me there. Well, let's start with the blood test then. If you're afraid of being touched there, let's start with a blood test. You can start with a blood test. And I don't want to go to the doctor because I'm afraid to ask for help. Well, how else can you get what you need if you don't ask for help?
And it's I always tell people we have to look at help as a different thing. I love acronyms. Help is healing, evolving, love, and provision. If we don't ask for it, we're not going to receive it. I always tell people a closed mouth can't be fed.
It won't.
um it just won't be fed. And we have to learn to use our voices. We use our voice for different things, but it seems like we use our voice less when it comes to our health. And that's one thing that we're working hard at Sisters Healing and Evolving to change, to give people back your voice, to
Mhm.
make sure that we are using our voice to advocate for our health, advocate not just for our health, but we have health challenges that we allow to go from generation to generation because we don't step up to the plate and ask questions. We don't step up to the plate and say, hey, this is in our family. How do we change this or prevent this from going from generation to generation? And we have to do a better job at it. We really do, because as we see, we're at the higher risk, on the higher spectrum of just about all diseases and health issues.
All of them.
Yes, all. And that's something to be said. And that's something to take note of.
Mhm.
It's not one disease, it's not two, but we're talking about many health challenges. And so as we prepare to wrap up tonight, tell people how they can get in contact with you if they need that referral. Simone, how can they get in contact with Black Nurses Rock of Greater Charlotte?
You can email Deborah or me. My email is bnrgc.treasurer2@gmail.com. You just give me the name and your phone number and probably your age and let me know what you need. We can and then we'll be in contact and figure out how to do the referral. And then Deborah, your email.
My email is bnr.gc.president@gmail.com. And we will do whatever we can to try to assist you. If you know of any events that are coming up that you would like us to participate in, that we can share more information, we love to come out and share information with you all. Just let us know what you need.
Awesome. I am so grateful that you have joined us tonight and you have just illuminated what we need to do as a community to change the narrative on health, especially heart health. When we look at heart health, it affects so much more than just our hearts. We didn't touch really on how it affects our organs or our kidneys or our liver or those types of things, but it does. And as you said,
Mhm.
we can find you out in the community, educating people, serving people through outreach. And also just get in contact with Miss Deborah and Miss Simone. There are some great women who are out in the community educating people. I'm excited to have had this conversation. I'm excited that you've taken time to invest in She by joining us to help us to educate the people, to advocate for themselves and their health status, and to know their health status. So I just want to take time to thank you, and to let you know that we are truly appreciative of all that you're doing in the community. And Black nurses do rock. We don't give you enough credit, because I'm going to tell you, I have not been in a hospital and seeing and not seeing Black nurses doing their jobs, doing what they do, caring for the people with sincerity and just patience. My sister is in the nursing field, and I salute her as well tonight. It's something to be said about someone who cares for someone else. It's just
Mhm.
not for anyone. It's not for anyone. And you have to really have a heart to do the jobs that you do. So I want to
Mhm.
salute you because guess what? You are Black history as well. And so I thank you
Absolutely.
tonight for being with us. And I am just truly grateful for all that you've done. If you'd like to say any closing remarks, this is the time. Just let everyone know just how great you are, and share whatever you would like to share before we close out tonight.
Well, I want to say thank you for having us. Thank you for what you're doing. Thank you for putting the spotlight out there on women's health and Black health. The most important thing that I would like to leave you with is to see your doctor, ask for help. Um, and again, if you don't like the first one that you meet, it's okay. Go to another one. Um, but take care of you. It's our greatest resource. We are our greatest resource, and if we don't take care of us, then it's all for nothing. What are we doing? What are we doing if we don't take care of us? Yes, we're here. We're put on this planet to be a service to each other. But if you can't take care of you, how can you possibly take care of somebody else? So you have to take care of you, and that starts by knowing your numbers, and that starts with seeing a doctor.
Love it.
I just want to say thank you for having us. What I want to leave this with is this is the first step is getting the education. Now your next step is to follow up on it. So we've given you some information. So I want everyone to make sure they follow up, pass it on to your family members and your friends that may not have had access to this call with us today. Just pass on the information, and then do your research before you go to the doctor. You know, knowledge is power. We're giving you some information here. You just research some more and make sure you follow up with your doctor. Listen to your doctor. If you don't trust what they say, get a second opinion and then listen to that doctor. We're quick to be like, oh, my blood pressure's down, I don't need that blood pressure medicine anymore. No, your blood pressure's down because you're on the medicine. Discuss it with your doctor. Eventually they can probably wean you off of it, but just don't stop the medicine. Or my friend said that they can't take the medicine and I shouldn't take it. No. I know we don't trust in providers as much as we should because of history, but you got to start somewhere. If you do your research, research the medicine also that they're about to give you. Don't just say I'm going to take it. um, One part I did mention at the beginning was there are certain medicines that don't work on African
Mhm.
Americans. Not sure why. Like one of the medicines they call the lisinopril or benazepril, it ends in prils. They're called ACEs. Black Americans have a risk of having an adverse effect from that, what we call angioedema. Their lips swell. So we should know as Black Americans, if we go and they're trying to put us on there, I don't want to be on that. We're high
You
risk.
just told me something new tonight.
Yeah, okay.
Yeah.
Yeah,
Or
so
what's the likelihood of this happening to me? Because it was a medicine that I could tolerate,
Mhm.
but it may not be something that you can tolerate. So you want to ask that question.
Yeah, so
What's the
research
likelihood of
it.
this happening to me? Because I've heard a lot of
Mhm.
us have angioedema, or our lips swell and our throat
I
swells
give those.
up.
Yeah.
What's the likelihood of that happening to me?
Mm. Yes. Ask questions, people. We must ask the questions. I
Yes.
am so excited. And if you ladies will stay on once we end the live, I
Mhm.
just want to share one other thing with you all. And I'm just grateful.
Oh,
So
thank you.
I thank you all for watching and tuning in tonight for the She Healthy Woman heart and the heart health in the African American community. It has been a wonderful conversation with the lovely Miss Deborah Crawford and the wonderful Miss Simone Bailey. We are excited that you tuned in with us. We hope that this information does not fall on deaf ears. We hope that you take this information, go back, research, consider, reflect on your own health. Make that appointment, that follow-up appointment, or even that initial appointment, and
Yes.
ask the questions. Go in there with your notebook, go in there with your pen, with your questions already laid out, and ask those questions. And if your questions aren't answered, you've heard it, Miss Deborah and Miss Simone said, go to another doctor, one that you feel comfortable with. Our health is our wealth. And Miss Deborah has reminded us that our health is our most important and most valuable resource. Thank you again for joining, and everyone have a wonderful night.
Good night.
Excuse me.